Hi everyone, I welcome you all to another series of our rationalization. So we'll be having practice questions at this time and we'll be talking about the respiratory problems mga kapatid, okay? So makakatulong po ito sa inyo sa lahat ng mga nagpe-prepare for the nearest PNLE and of course for the NCLEX, okay? So mga kapatid, no, all of those things that we'll be talking right here, right now, we'll be covering adult health nursing and even pedia po ang pagdating po sa ating mga pharma, sa ating respiratory problems. Okay, again, this is Julie Scala, your nursing buddy, helping the nurses of the future. So how are everyone, guys? So I hope and I pray that you're doing well and you're preparing well for examination po na kakaharapin po natin. So prepare for the greatest battle, study smartly, study also hardly, but I prefer to advise you to study more smartly. Okay, so we'll be having some rationalizations here and let's start here right now kapatid. Okay, so first question, which of the following is not yan, okay, an indication for chest tube therapy? Okay, so chest tube therapy or CTT kapatid, no, it's you know this, okay, this is a management that's done in your respiratory system, okay, and we have an indication for this one. So kailan natin to ginagawa? So chest tube therapy is actually done for your, or CTT is done for your 5 major and we have the mnemonics here, okay, 5 major indications. First, we do this for your pneumothorax patients, okay, pneumothorax patients, okay. And also kapatid, pangalawa, we do this for your patients with your effusions and we call it as your pleural effusions, okay, pleural effusions. And also class, we do this for your patient kapatid na meron pong abscess, okay. And also kapatid, we're doing this for your patients kapatid na meron pong cancer, and of course what type of cancer? Lung cancer, okay. And lastly, okay, so we also do this, we also provide your CTT for your patients kapatid na naghe-hemothorax, okay, hemothorax. Hence, let's do this one by one. So pneumothorax kapatid, correct, okay. So we pneumothorax is an indication, no, for your chest physiotherapy, while your lung cancer is also one, and of course your pleural effusion is also one. So the best answer here kapatid, because we're looking for the wrong answer, okay, so basically we eliminate letter A, this is wrong. Letter B, lung cancer, because what we're looking for is the wrong answer, okay. So the best answer for this one is letter A. We don't do chest physiotherapy, chest tube therapy for your asthmatic patients, okay. D is the best answer. Let's have another question. Which of the following considerations is most important prior albuterol therapy? Yan. So ano daw ang pinakamahalaga, no, na consideration na mayroon tayo dapat na prior or bago magbibigay ng albuterol therapy? So albuterol, this is a bronchodilator kapatid, okay, bronchodilator, and to be specific kapatid, this is actually a beta adrenergic, okay, adrenergic agonist. So ibig sabihin kapatid, isa sa mga function niya is to dilate your bronchi or your airways, okay. So ang tanong dito, anong pinakamahalagang consideration bago natin o bago tayo magkaroon ng albuterol therapy? Letter A, check the patency of the IV fluid. Letter B, monitor signs of extravasation. Letter C, check patient's pulse. Letter D, take fit full stomach. Kapatid, bago tayo mag-ratio, bago tayo mag-eliminate ng mga bagay-bagay, I would like you to know that your albuterol, just like your salmeterol, okay, magkakapatid po sila, salbutamol, yan, okay, yan, just like your salmeterol, salbutamol kapatid, they are best given in nebulization form, okay. So what I'm trying to say is that inhalation po sila, okay. So automatically kapatid, if you know albuterol, how it's given, so basically you will be able to answer this one here, okay. You eliminate letter A, check the patency. Also, it's not for extravasation. Actually, letter E and letter B, they are actually telling us the same thing. Letter C, check the patient's pulse. Letter D, take with full stomach. Again and again, it should be taken. Ito class, this is for your oral. This is for your IVs. So the best answer here, kapatid, okay, is letter C. Okay, check the patient's pulse. Why? Do you know that your, kasasabi natin kanina, that your albuterol is a beta adrenergic agonist. So, ibig sabihin, it allows the function of your beta adrenergic receptors. While it actually allows you, it allows you to bronchodilate. We should also be able to check the patient's pulse. It's because it is actually we should be very careful for your patients experiencing tachycardia, because it might give you plus the because of a certain effect to our pulse, which is sometimes we call it as your albuterol or salbutamol or salmeterol induced tachycardia. Okay, so it will increase further your pulse. So we better check it before we are able to administer or to start nebulization with this type of medications. Okay, so that's it. C is the best answer for this question. Let's have another one. After thoracentesis, the patient should be monitored for signs of letter A, hypotension, letter B, pneumothorax, letter C, pneumonia, letter D, tachypnea. So basically what we are asking here is there is actually condition which is normally a complication. Okay, the most common complication actually of your thoracentesis is your pneumothorax. Okay, so the best answer here, kapatid, is letter B. Okay, letter B, pneumothorax. Okay, so it would now include your lung collapse, okay, just like your atelectasis, which is a manifestation of your pneumothorax. Okay, so we better be very careful with and we closely monitor our patients, kapatid, na under po after your thoracentesis, to monitor for signs of your pneumothorax. Okay, so let's have another question. While caring for a patient under CTT, you observe that tidalling in the water seal chamber has diminished. This is a sign of letter A, dislodgement of the tube from the chest, letter B, lung expansion, letter C, normal findings, letter D, disconnection of the tube from the drainage. Okay, so kapatid, ganito yan. Ang ating pong CTT, if this is the patient, okay, this is the patient, yan. Our patient is connected to a CTT, and remember, for your CTT to be operational or functional, it should be always below or way lower than your it should be lower than your patient's I mean the site, the insertion site in the patient's chest. Okay, so now ganito yan, may tatlong bagay po na dapat tayong malaman when it comes to your CTT. So basically, we have three very important compartment here, which is your first, we have your suction. Okay, your suction chamber, tatlong chambers po ito. Pangalawa, yung water chamber. Yan, your water chamber. Okay, and last but not the least is yung ating pong drainage chamber. Yan. So in your suction chamber, what's the most important thing here is because it's suction. Okay, basically there would be bubble, but the term that you will have to look for in the PNLE question, it should be gentle bubbling. Okay, gentle bubbling. Okay, so kapag lumabas na po yung rapid bubbling, that's already something that's not normal or beyond normal. In your water cell chamber, there is your what we call as your intermittent bubbling. Okay, so ang pinakamahalagang bagay na meron po tayo sa inyong water cell chamber is yung tidalling na sinasabi natin. Okay, so tidalling is an important indicator na normal po, or ibig sabihin pattern po ang ating tubing in your CTT. While in your drainage, we are not actually expecting here some no bubbling po ito. Okay, no bubbling. So basically, tidalling should always be involved in your water cell chamber. At in this case, kapatid, na kung saan nawala na po yung tidalling, dalawa po ang condition na kung saan nagdi-diminish ang tidalling. Okay, there could be kinking or either the lung has expanded. Okay, the lung has expanded. Okay, so the best answer here, yan, dislodgement is wrong, disconnection is also wrong. So kung nakita po natin yung kinking, that can be the scenario here. But what we have here, okay, this, we eliminate this one, we also eliminate this one, and of course this is not a normal finding. The normal finding is that there would be tidalling, not diminished tidalling. Okay, so the best answer here, kapatid, is of course letter B is the best answer. Okay, tandaan po natin yan. Let's have another question. A known asthmatic patient was rushed to the emergency room, and upon assessment, the nurse assessed that the patient has no audible breath sounds. Nebulization with bronchodilators was initiated. So basically, parang nag-start tayo ng salbutamol or albuterol, and the patient was closely monitored by the ED nurses. So after an hour, expiratory wheezing was audible and the patient was still in close monitoring. This scenario means, ano daw ibig sabihin nito? So pagdating ni pasyente, walang breath sounds. So nag-start ng bronchodilators, nebulization, tapos minonitor. And after an hour of monitoring, ang nangyari is nagkaroon na ng wheezing, tapos audible na wheezing, and closely monitored pa rin si pasyente. Anong ibig sabihin daw ng pagkakaroon na ngayon ng wheezing? Letter A, the condition is worsening. Letter B, the condition has improved. Letter C, the patient's airway inflammation has increased. Letter D, the RRT needs to be activated. Okay, kapatid, ganito yan. Para mas maintindihan natin, let's try to eliminate some things here. Okay? By doing that, let's have first an explanation kung bakit nagkaroon ng ganito. So pagpasok ni pasyente, this is the most dreadful situation na meron si pasyente. Just imagine, wala nang audible breath sound si pasyente. So ibig sabihin nun, kapatid, the airway, okay, ang airway po na pasyente is too narrow. Okay, so napakasikip po ng airway ni patient at this time. Okay, too narrow because probably of the inflammation. So wala ka nang maririnig na breath sounds. So nag-start ng nebulization with bronchodilators ang nurses in the emergency room, and after an hour, may narinig na wheezing. Anong ibig sabihin nun? Okay, so basically you eliminate, kapatid, okay, letter A and letter C because they mean the same thing. Okay, ibig sabihin, sabi dito, the patient's airway inflammation has increased. Ito naman, worsen. Ibig sabihin, pareho sila ng ibig sabihin. Okay, so letter B, the condition has improved. Okay, so now that we have, pagkapasok ng pasyente, merong walang breath sounds, and then nag-start tayo ng nebulization, and then what happens now is nagkaroon na ng wheezing. So ibig sabihin, kapatid, the patient's condition is actually improving. So that's what we want to happen. Okay, so mayroon na dito si pasyenteng so basically what happened here, kapatid, is that nag-improve na po ang airway ni patient. So the presence now of wheezing, although it's an abnormal breath sound, it's an indication, kapatid, na nag-improve na po ang inflammation po ay nag-diminish. Okay, partly because we started our nebulization. So the best answer here would be letter B. Okay, B is the correct answer. So let's have another question here, kapatid. Okay, next question. Which of the following assessment, okay, is found in a patient with COPD? Okay, sabi sa letter A, lateral tracheal deviation. Letter B, prolonged fever. Letter C, 100-day cough. Letter D, widened anteroposterior COPD. Okay, so letter C, basically this is wrong. This is actually your pertussis. Okay, this is actually your pertussis, kapatid. Okay, while your letter B, this is your fever is part actually of your normal infection process, just like in the case of your pneumonia. So ganun po ang nangyayari. While your letter A, okay, this is actually common in your pneumothorax. Okay, so lalo na pagdating po sa mga nagkaroon na ng lung collapse. That's why a pressure is within the thoracic cavity, so nagkakaroon po ng in one side of your lungs, so nagkakaroon tayo ng tinatawag nating lateral tracheal deviation. Okay, so the best answer for this one, kapatid, is letter dog. Okay, dog is the best answer. Okay, so we call this one actually as your barrel chest. Okay, common to na lumalabas, so we call this one as your barrel chest. Okay, so A, B, and C are eliminated, so D, okay, is the best answer for this question. Okay, let's have another question, kapatid. Which of the following is present? Yan. So, tinatanong dito, which of the following is present daw? Okay, on a pediatric patient with cystic fibrosis. Yan, big word. A, watery stool. Letter B, melena. Letter C, oily bulky stool. Letter D, projectile vomiting. Okay, so simple lang. May cystic fibrosis ang pasyente. Ano daw ang manifestation na makikita natin sa kanya? Okay, so basically, we eliminate, kapatid, your letter A, watery stool. This is a basic symptom of your diarrhea. Okay, so wala pong ganyan masyado when it comes to our cystic fibrosis, kapatid. Okay, so eliminate letter A. While your letter B, melena, is actually a sign of your upper GI bleeding. So say for example in your peptic ulcer disease, so nagkakaroon po tayo ng melena. Okay, so this is actually wrong. Okay, we eliminate that one. While your letter D, projectile vomiting, is actually a common sign of your common GI obstruction. Okay, so you eliminate, kapatid, letters A, B, and C. So what we have now is actually in your cystic fibrosis, what we have, kapatid, is your oily and bulky stool. So letter C is the best answer here, kapatid. Okay, so let's have another question. Which of the following therapies are best? Yan, therapies. So, ibig sabihin, medication, yan, management. For pediatric patient with cystic fibrosis, select all that apply. So, actually, those things, kapatid, that we provide on your cystic fibrosis patient, okay, for your CF, okay, the best management that we can give, number one, is multivitamins. Okay, multivitamins. Yan, multivitamins. Okay, and also what we give here, kapatid, is nag-nebulization din tayo. Usually it's of your bronchodilators generally. So what we use is your salbutamol, salmeterol, okay, or your albuterol. Okay, bronchodilators. And of course, kapatid, we also give your patient the proper hydration. Okay, so the best answer here would be letter B, letter C, and letter F. Okay, so B, C, and F. Okay, so those are the things that we give, kapatid. You eliminate letter A, letter D, and also letter E. Okay, so let's continue. Another question. Which of the following intervention is best for parents? Ayan, of a patient with cystic fibrosis. So, kapatid, simple lang. If ganito ang mga tanungan pagdating po sa ating examination, it can be your PNLE, it can be your NCLEX, it can be your NCM examination at nursing schools. So, the best thing that we should be thinking about here is that kung paano tayo tinatanong ng exam. Okay, so, halimbawa, which of the following intervention is best for parents of a patient with cystic fibrosis? So, you immediately think of those things that are best for the family as a whole. Okay, letter B, enrollment to wellness program. Why is there a need for us to have a wellness program here? Okay, is there something wrong with the family? Wala naman. Okay, letter C, aversion therapy. This is psych. Okay, letter D, attendance to spiritual gatherings. You know what, our nursing care is not impartial. Although we need to be in the open, but what's best for the patient, kapatid, here, I mean for the patient's family, is to have a strong emotional family support. Okay, A is the best answer here. Okay, let's have another question. Which of the following is an action of hydrocortisone? Yan, for asthma. Okay, so again, this is a corticosteroid, this is a steroid, big word yan. Okay, so basically, ano ang ginagawa ng yung steroid is to decrease cluster inflammation. Okay, so it decreases your inflammation. So letter A, it blocks histamine 1 blockers. It blocks histamine 1 receptors rather. Letter B, it decreases bronchial secretions. Letter C, it decreases airway inflammation. Letter D, it humidifies mucus in the airways. Okay, so the best answer here, kapatid, okay, the best answer here is letter, from the word itself, inflammation, big word for the examination. Letter C, it decreases the airway inflammation. Kapatid, ano ang nasa letter A? Letter A is wrong because this is actually the function of your antihistamines. Okay? Antihistamines. Sa pinaka-common, kapatid, no? Blocks histamine 1 receptor. Ang pinaka-common na binibigay natin dito is your diphenhydramine. Okay? Diphenhydramine. So, this is wrong. It decreases bronchial secretions. This is actually functions of your anticholinergics. Okay, anticholinergics. Okay, while your humidification of your mucus, from the word itself, okay, this is a function of your mucolytics. Okay, mucolytics. Okay, so the best answer here, kapatid, is letter C, of course. That's the best answer. Let's have another question. Polycythemia is a complication of, ayan. Okay, so I would like to have you spoiled here that the best answer is letter D, COPD. Okay, so polycythemia is actually a condition wherein there is an increase of your blood components, primarily, kapatid, of your RBC. Poly means many, so it is actually you're like creating many blood components, specifically your RBC. Okay, so here, increase RBC is what we call as your erythrocytosis. So what happens here, kapatid? In COPD, there is actually a problem of decreased oxygen level sa katawan natin. Okay? Oxygen level. So basically, if we put our patient in an auto-saturation or pulse oximeter, it will just give us 90 to 92% auto-sat. And that's just normal for the patient. Again, because the oxygen level of the patient, because they've been, para silang naging sanay ang katawan, no, kapatid, for the low oxygen levels. So what does that mean, kapatid, when it comes to your RBC or your blood component? Simple lang, kapag mababa po ang ating RBC, kapatid, kapag mababa ang oxygen level, mababa din ang RBC. So anong ginagawa, kapatid, ng inyong kidney? It will create more and more RBC, okay, by releasing this hormone which we call as your erythropoietin. Hence, nagkakaroon po tayo ng tinatawag nating polycythemia vera. Okay, so the best answer here, kapatid, okay, is letter dog. Okay, D is the best answer. Okay, COPD causes your polycythemia. Let's have another question. While caring for a patient with CTT, you palpated a crackling and popping. Okay? Yan, may crackling daw, no? Pasyente natin may CTT, tapos nakapalpate tayo ng crackling and popping sensation at the insertion site. Okay? With this assessment, which of the following should be the proper action by the nurse? Okay, A, document the finding. Alam mo, kapag nakikita mo yung document the finding, you're assuming that what's being asked is just normal. Okay, so letter B, apply a sterile gauze. Letter C, place the tip of the tube in a sterile bottled water. Letter D, notify the physician. Alam mo, kapatid, kapag naka-assess tayo ng crackling and popping, okay, at the insertion site, this is actually an indication of, big word, air leak. Okay, air leak or leakage of air. Okay, so this is an abnormal findings, and what do? What do we do here, kapatid? So this is not a normal finding, so we do not document it merely. We do not apply sterile gauze. Why are we going to apply sterile gauze in the first place? Okay? Why do we need to place the tip of the tube of the sterile bottled water? Meron lang leaking. So what do we do here, kapatid, is we notify immediately. We report the findings to the physician or to the healthcare provider. Okay, so the best answer here, kapatid, is letter D, Dallas, for this question. Okay, another question. These are high-pitched, yan, big word, high-pitched, inspiratory, abnormal breath sound. Yan, ano daw yan? Letter A, wheezing. Letter B, crackles. Letter C, rhonchi. Letter D, stridor. Again, these are high-pitched, inspiratory, abnormal breath sound. Yan. So, kapatid, kapag sinabing abnormal, these are otherwise known as your adventitious breath sounds. Okay? So, ano daw ang tawag sa kanila? Letter A, wheezing. Letter B, diminished crackles. Letter C, rhonchi. Kapatid, kapag sinabi natin crackles, this is actually your, the big word here is your this is for crackles. Okay, the big word here would be your popping. Yan, para siyang nagpapop na wood, okay, or burning sound. Parang ganun. Just imagine nagbe-burn ang wood. No, ganun po ang sound niyan. Okay? So, letter B is basically wrong. Okay? Okay. Well, you're wrong, kay kapatid. Okay? Kapag sinabi naman natin wrong, kay, this is actually a low-pitched. Okay? Low-pitched. This is not a high-pitch. Okay? Low-pitched, kapatid. Okay? Low-pitched na snoring sound. Okay? So, snoring sound. Okay? So, this is actually an indication na may mga secretions tayo in large airways. Okay, so this is wrong. Okay, so the battle is between letter A and letter D. A wheezing, letter D stridor. Para mas madali nating tandaan, kapatid, let's try to have this trick. Okay? So, kapag sinabi po nating wheezing, yan, wheezing, it has two letter E. So this is for your expiratory, yan, high pitch sound. Okay? High pitch sound. Okay? So what's our problem with your stridor is that it is also a high pitched musical sound. Okay? Stridor. But the problem that we have your stridor, and the one thing that we need to think about is that this happen in your inspiration. So this is an inspiratory high pitch sound. Okay? High pitch sound. Okay? So we call that as your inspiratory high pitch sound. So basically the best answer for this one, because inspiratory po ang tinatanong, is letter D, stridor. Okay. Letter A, this is expiratory, wheezing. Okay? High pitch, expiratory, high pitch sound. Okay, so the best answer for this one is letter D. Dog is the best answer. Let's have another question. While receiving COPD patient at ER, which of the following assessments would prompt you to call the physician? Letter A, a BP of 120/80. Take note, eliminate natin agad, that's just normal. Letter B, RR of 19 CPM, that is also normal. Okay, so letter C, 91% auto-saturation at room air. And letter D, temperature of 38.9 degrees. Again, sinabi ko sa inyo kanina, 91% is just but normal for your patients, kapatid, na mayroon pong COPD, because they are actually low oxygen breathers. Okay? So, the best answer here, kapatid, is letter D. This is an indication, kapatid, na si pasyente po natin ay nag-i-infection na po. Okay? So, D is the best answer for this one. Okay. Ayan. Let's have another question. While taking care of an asthmatic patient taking salmeterol nebulization, the attending physician orders other set of medications for the patient. So which order will you question? Okay? Letter A, diphenhydramine. Letter B, methylprednisolone. Letter C, dalchazine. Letter D, metoprolol. Okay, again, while taking care of an asthmatic patient taking salmeterol nebulization, the attending physician orders other set of medications for the patient. Which order will you question? Okay, so ang question lang ganito. So may asthmatic na pasyente, tapos nagsasalmeterol nebulization. Tapos nag-order si doctor ng other set of medications. Ano daw ang i-question mo dito? So ibig sabihin ano ang mali no sa mga bagong in-order ng doktor. Yan. Okay? So letter A, diphenhydramine. This is actually correct because diphenhydramine is an antihistamine, so we need to lower down the histamine reaction. Okay? Prednisolone is also given. This is also checked. Why? Because we also give anti-inflammatory effect, no? Ang habol po natin is the anti-inflammatory effect of your steroids, just like your methylprednisolone. Letter C, dalchazim is a CCB. Probably, no, nakita dito ni doctor na ang ating pong pasyente ay mayroon ding hypertension. And letter D, metoprolol. This is also another hypertensive. So again, remember that your salmeterol, just like your albuterol and your salbutamol, they are your beta adrenergic, okay? Beta adrenergic agonists. So ibig sabihin, kung ano yung function ng beta cells natin, okay? So they will promote it just like your dilation, no? Bronchodilation. So ang problem natin dito is that your metoprolol, kapatid, is a beta blocker. Okay? So now what I'm trying to say is that the function of your metoprolol actually contradicts the function or the work of your salmeterol. So letter D is the best answer. You need to question that one. Doc, bakit tayo magbibigay ng beta blocker? We are now giving beta agonist. Okay? So we are ang ating pong kasi metoprolol, that's a beta antagonist. So our salmeterol is a beta agonist. Okay? So D is the best answer. Yan, gumagaling na tayo sa ating pagrarasyo, di ba? Yan. So I know that you're also practicing yourself, no, while you are having everything here in our YouTube channel. So yan. Please watch pa for other videos that we have here. Okay. Another question, kapatid. All of the following may trigger asthma. Ayan. All of the following may trigger asthma attack except, yan, letter A, playing with catfish inside a bowl. Letter B, 42 degrees Celsius room temperature. Letter C, plowing of leaves in the backyard. Letter D, playing basketball with friends. Okay. So basically, your asthma triggers are actually divided also enumerated also into your mnemonics asthma. Okay, so what are these? What are these things here, kapatid? Okay, first, kapatid, we have your letter A. So, ano ba ang nasa letter A? These are your allergens. So, anong mga halimbawa ng allergens po natin? So, ibig sabihin, yung mga leaves, no? What else? Your pollen grains. Yan. So, those can be cause of your asthma. Okay? So, letter A, asthma is actually this one referred to in letter C. Okay? So, hinahanap natin is except. So, we need to eliminate letter C. Okay? Flowing in the of leaves. Kasi leaves, kapatid, is an allergen. Okay, letter S. Letter S stands for your sports, okay, or smoking. Okay? Sports or your smoking. So, that's it, kapatid, no? So, just like your basketball, yan, smoking, that's why ang smoking po, kapatid, no, it's very, very dangerous as well kapag nasa bahay po, no? So, meron po tayo ditong option na referring to this one. We have here your letter D. Okay, playing basketball with friends. Yan. Okay, another is your temperature. What type of temperature? Your extreme temperature. Masyadong mainit at masyado ding malamig. Okay, so here, ayan, 42 degrees Celsius room temperature. This is actually masyadong mainit. So letter B is actually also wrong. So that's a trigger. So what we're looking for is except or yung mistake. Okay, so hazards din po, yung ating pong hazards po can be a cause of your asthma attack. So dito, playing with catfish kapatid is actually the best answer. Okay? Best answer dito is your letter A. Okay, other causes also triggers of your asthma include your microbes, okay, your microbes, which can be example also your molds, okay, lahat po ng yan, okay, and also your anxiety, okay, so we give our patient lesser stress, okay, or less anxious, or less anxiety triggering situations, okay, so A is the best answer. Catfish, so you might have been thinking, cat, so okay, what we're just imagine, no, and also here kapatid, nasa loob lang ng bowl or ng para siyang aquarium yung isda, okay, so it doesn't give us any problem here. Okay, so let's have another question. Which of the following drugs is given for a patient who had pulmonary edema, yan, after a near drowning, yan. So kapatid, actually ang problem natin with your pulmonary edema after your near drowning is that in your alveoli, okay, actually there are some things na wash out po, may na wipe out po dito, okay, and big word there is your surfactant, okay, surfactants. So what do we give to your patient? Basically class, we give them your surfactants, okay. So, para magkaroon din ng gas exchange. Kapag walang surfactant, kapatid, walang gas exchange. Hence, that's gonna be a problem also. So, surfactant is the best answer, letter C. And you can give me a best example. We can have your poractant, poractant alpha. Okay, this is an example, kapatid, of your surfactants here. Let's have another question. Which of the following should be kept at the bedside of a patient with CTT? Yan, may CTT daw tayo. Alin daw sa mga sumusunod ang dapat ay nasa bedside po ni patient? So, ito naka-CTT po si pasyente. Yan, again, kapag naka-CTT po, the drainage system or the tubes po natin, it should be lower than the side po ng pasyente. So, tatlong. Okay. So, dalawang case po ang pwedeng mangyari. Pwedeng ma-dislodge po. Pwedeng ma-dislodge. Okay, saan ang dislodging? Pwedeng matanggal dito sa number 1, yung tube. Pwede ring matanggal dito sa number 2, yung tube. Okay, kapag dito po sa number 1 or on the patient's chest po matanggal ang ating tubing, what do we do kapatid is we just put an occlusive dressing kapatid. Okay, we put an occlusive dressing and then we tape our patient on those 3 sides. Okay, so halimbawa ito yung chest, ito yung patient's chest. Okay, nandito yung site. Okay, tapos i-tape po natin here at letter A, here at letter B, and here at letter C. Okay, so we don't type here at the other side kapatid. Okay, so that would cause us your tension pneumothorax as well. Okay, so because of too much pressure po sa loob ng lungs. Okay, so another, kapag dito naman po sa number 2 magkaroon ng dislodgement or disconnection, what do we do is dapat may naka-ready po tayong bottled water, sterile bottle. Okay, it can be a bottled water, bottle of water, basta it should be sterile. Okay, so best answer kapatid here is letter B, sterile bottle. Okay, ayan. Obturator, this is for your tracheo. Okay, and sa scissors kapatid, this is best at the bedside kapatid kapag ang tanong is yung ating pong Sengstaken Blakemore tube. Okay, Sengstaken Blakemore tube. Okay, tube. Okay, so B is the best answer. Let's have another question. Which of the following manifestations primarily indicates pulmonary embolism? Okay. Letter A restlessness. Letter B, loss of consciousness. Letter C, urinary urgency. Letter D, headache. Big word, pulmonary embolism. Kapag may pulmonary embolism tayo, it's like an emboli has been dislodged in the pulmonary circulation. Okay? So, the most common manifestation dito kapatid is that si patient is para siyang nawawalan ng hininga. Okay? So, hindi siya mapakali. So, that's what we call as your restlessness. Okay? So, A is the best answer for this question. Okay? A is the best answer. Which of the following manifestations on a 24-hour post-tonsillectomy patient would you immediately report to the attending physician? A, slight pain in the surgical site. This is just normal. Letter B, temperature of 37.2. This is another normal. Okay? Letter C or letter D? Yawning. Yes, you can yawn all you want. Okay? So that's just but normal. But what's not normal is actually frequent swallowing. Why? Because this is an indication, kapatid, of bleeding. Okay? This is an indication of bleeding in the surgical site. So, letter C is the best answer. Okay? C is the best answer. So, again, maraming salamat po for being with us. Hopefully, kapatid, with our 23,000 na higit na mga subscribers and all of those na nagpapatuloy po na manood po na our rationales and our lectures here on the YouTube channel, maraming salamat po sa inyo. Hope to see you guys on our next uploads. Ingat!